When Olivier speaks, we cannot speak between us. Otherwise, the camera faces us and record what we are saying. Yeah. Okay. You need to be aware of that.
But we can close the microphone.
Crazy also.
Sorry?
And the translators, they can't have two audio.
So you have to be quiet when the other people speak.
Yeah.
And we just close the microphone.
We can. This we can do. We could also close the mic.
Yes, but then we need to go to the screen each time.
Yeah.
Yeah. Okay.
All right. So
You
we'll
need a
live
last one.
for 2 hours.
If it's
That's fine.
minute to go.
Okay, good morning, everyone, and welcome to the European Trade Union Institute's annual Occupational Safety and Health Conference. My name is Paula Franklin, and I work as a senior researcher here at the ETUI. And before we start the actual conference, I would just like to make a couple of practical announcements. Firstly, please double check if you have access to interpretation. You can move your mouse over the bottom of the Zoom screen and you should have the Zoom menu appearing. You will notice there a globe icon, and if you click on the icon, you will see the different interpretation languages we have for the meeting. And these are English, French, Spanish, German, Portuguese, and Czech Slovak. If you cannot see the different languages, it probably means that you need to download the latest version of Zoom and restart your computer. And the link to download the latest Zoom version will appear in the chat box, so you can just click and move on from there. If you do experience any technical problems during the meeting, you can send a chat message and someone will be there reading your message. Please do note that the messaging does not have the interpretation function, so you should ask technical support in English only. If you have a question or comment concerning the content, the discussions that we have today, please use the Q&A function, so the questions and answers function of Zoom. And for your information, the conference will be recorded and it will be posted online later. Now, today we will have two sessions. In the first one, we will ask how to make work safe for the next pandemic. And in the second session, we will be discussing the topic of long COVID and return to work. But let's move on with the first panel of the day, which will be chaired by Bianca Luna Fabris, who is an ETUI communications officer. Over to you, Bianca, at the ETUI studio.
Hi, hello, and welcome everyone. Welcome to the second day of the conference. And this morning we'll be dedicating ourselves on how to make work safe for the next pandemic. We have in studio 3 of our guests, and we have one of our panelists joining from from online. Hi, Oliver. Thank you so much for joining me this morning. Oliver, our panelist that is joining on Zoom, he is a bus driver and worker representative on the Committee for Prevention and Protection at Work for STIB, and he works here in Belgium. Martina Di Rodolfo, she is Program Officer of Occupational Health and Safety and Digitalization at ETUI. Enrico Somaglia, he is Deputy General Secretary at EFET, and then our in-house expert on health and safety, senior researcher here at the ETUI, Tony Musu, will be joining us for the very end of our discussion today. If you have any questions, please do put them in the Q&A. We're very much looking forward to hearing your thoughts and also to responding to any of your questions. This session is going to be a bit more of an interview style question, so really do feel free to jump in at any time, and we'll address the questions at the end of the panel. So thank you so much for everyone for joining us. Enrico, I would like to actually start from you, if that's okay. So at the very beginning of the pandemic, we've seen all over the news and all over Europe that the meatpacking industry has been heavily impacted by COVID-19. So 1 year on, what has happened? Has anything changed?
Well, first of all, thank you very much, Bianca, for your question, and thank you to the ETUI to organize this conference. Here, the setup looks great. It's just a pity that we cannot have the audience here with us, the participants. But yeah, to answer to your question, so has anything improved? I would say yes and no. It depends very much. The situation is still very different country by country when it comes to the meat sector. Let's not forget that the reason why the sector became a vector for the spread of COVID-19 has to be found really in the deplorable housing and living condition and working conditions of a vast majority of workers employed in the sector. This is a sector that relies a lot on mobile and migrant workers, and they were really forced to share overcrowded accommodation because these accommodation were linked to their work contract. They were forced to carpool, and they work in close proximity. So we had really many issues strongly related to their working and housing conditions. And this has been the main reason for the spread of the virus. And yes, some countries have taken important measures. They have reacted to the demands of our affiliates, but some others no. And most of the time, these countries that have not taken initiative are those countries where we have poor collective bargaining systems, and collective bargaining has proven to be a very effective tool, a trade union tool, to really also manage the consequence of the pandemic in the meat sector. In the countries where collective bargaining functioned well, we had less cases, and even when we had cases, they were managed in a better way. But you asked me about improvements, so I can definitely mention Germany as one of the countries where there have been more actions taken, important actions taken, and the German government has really reacted in an effective way, I would say, adopting measures that really are reforming the sectors. I can mention, for example, the law that bans subcontracting in the sector from 1st January 2021. Sorry, this was a key demand of NGG, our German affiliates, because subcontracting was a major source of dumping also across Europe. So this is a good news not only for German meat workers, but for all meat workers in Europe. But they went beyond. They also really limited the temporary agency work with a ban that started on 1st of April 2021, a ban in cutting and in slaughtering. It is still possible to have temporary agency work in processing, but limited to 8%, and only when there is a collective bargaining agreement with NGG. And this triggered the possibility to have a nationwide collective bargaining agreement for the whole meat sector in Germany on wages. So negotiation started, and they were able to really start to fix wage scales. And now they are also discussing about having really a collective bargaining agreement on working conditions in general. So this is really very good news, because yeah, Germany was really a source of dumping for the whole of Europe, with many jobs lost in the neighboring country, in particular in Denmark, in France, also here in Belgium. Ireland also is a good example, with important measures that have been taken following the pressure of our affiliates from SIPTU. I must say that also in Germany and in Ireland, We see important improvements in terms of organizing. This is a difficult sector to organize because there are many precarious workers, really difficult to assess, to talk with them. Many of them, they are really suffering exploitation, but we see really concrete improvements also in this respect. And in Ireland, just to mention one important victory that has been achieved by SITU. So can you imagine in Ireland, 92% of meat workers were not covered by sick pay. And this happened during the pandemic. So they realized from one day to another that if they felt sick, they could not take any sick pay. And now, at least, there is a beginning to have a wide scheme on a sick pay, and this is important for the whole sector. So yes and no. What we are still missing is a coordinated response at EU level. So we are still missing really a reaction from the European Commission on our demands, and we want a coordinated response at EU level because any initiative taken in a single country, like those that have been taken in Germany now, they really run the risk to fall short in addressing the problems that we have in the meat sector if we don't have a coordinated response at EU level. Because this is a sector that relies, that has a huge transnational dimension in terms of labor mobility, in terms of trade. And therefore, we really run the risk that the important achievement that we got and the improvement that we achieved in some countries are going to be wasted because other countries, they can copy the models that were not sustainable, like the subcontracting system in Germany, and then we would have a problem. And the second reason why we demand you to take action is because many of the reasons why meat workers face enormous challenges are strongly linked to areas or policies where the European Union has clear competencies. Labor mobility, international trade, but also the functioning of the food chain, all the imbalances that exist. They need to regulate the power of supermarkets that exert a lot of pressure on prices and therefore on working conditions. And this kind of response from the European Union is still missing. Of course, we rely a lot on these initiatives like the minimum wage initiative, and in particular the part that aims at strengthening collective bargaining as well. We hope that the due diligence directive will also be issued as soon as possible. We are very worried about this delay, but we need more. We need social policy measures. We need to regulate subcontracting. We need to regulate labor intermediaries, and we need also other measures on that look really at the functioning of the food chain.
Brilliant. Thank you so much. Martina, then if you can switch sector and go to your own sector, what has happened in general terms throughout the pandemic for the educational personnel? How has the educational personnel been impacted by COVID?
Thank you, Bianca, and let me underline the added value of being here today and also to compare with different sectors to see which are the common points that we experience, but also the differences of each sector. So without a doubt, the education sector has been unprecedentedly impacted by the COVID-19. The most direct threat on health and safety of teachers was the exposure to the virus, while most of educational activities were shifted either online or remotely. Several countries and education institutions pushed teachers and academics to continue working on site despite health and safety conditions were not respected. So our member organizations and we as ETUI at European level have been demanding that, of course, in-present teaching was important because education is a social activity. So we believe in the value of in-present teaching, but in-present teaching is only possible when health and safety of teachers and students is respected and is ensured. So there has been some attempts and we have recognized the emergency of the situation. There has been also some tools also at European level, for instance, some risk assessment with a focus on COVID, but that was not enough. We had several good practices, for instance, from our member organizations with regard to the support for the ventilation. We had cooperation, for instance, in the UK between different trade unions, including teachers and school leaders, to draft some step-by-step guidelines on how can we improve ventilations. In Belgium, for instance, unions have been lending some CO2 controllers to be installed in schools to measure the quality of the air. Another, I would say, indirect but also very important threat was the long COVID. There has been research on long COVID yet. It's a topic that still remains unexplored, and there is a clear demand from member organizations to keep analyzing the health impact also on the daily working life of teachers. So education has been running in unsafe conditions. We had thousands of teachers that got infected and died because of COVID-19. So that was really an indirect effect, a direct effect on the health and safety of teachers. But as I mentioned, the switch to online and hybrid teaching, remote teaching, there were several good practices across Europe, but all of them have a common point: the unpreparedness of education system. So the shift was rapid, the measures taken were urgent, but as a consequence, teachers didn't have enough continuous professional development on how to switch their pedagogical methods to a totally different context. For instance, you cannot apply the same pedagogical methods when you teach in presence or when you teach online. Or we had, for instance, lesson both through radio or television. There were some teachers that made up some podcasts for letting their students to take a walk during their lessons. So I would really underline the unpreparedness of our education systems. So we can argue that teachers didn't have enough digital skills, but that this also relies with the lack of digital infrastructures. There has been many arguments saying that COVID was also an opportunity to explore new methods of doing education. That is true, but these need to be built over the years. And also the measures that were taken, like we had just a very few measures of, for instance, providing additional staff for teachers. And I stress this because COVID was also the event that made even bolder the pre-existing issues in the education sector: shortage of teachers, the size of classes. Imagine teachers when holding their class with classes of 36 students. There was a huge problem of dropping out, in particular disadvantaged groups, groups with a disadvantaged economic and social background. These students were totally excluded from educational activities. Students with disabilities, they also, there was in that context a lack of education personnel that could support and could ensure that students with special needs were totally in the educational activities. Then the impact on mental well-being on teachers was also important. And here, the precariousness aspect come into play because, and I refer to the right to disconnect that as workers we have all experienced, but precarious workers in the education sectors that has limited hours already in normal times went really to the extra mile, both for the preparation of classes in a totally novel scenario, but there were further and growing expectations, both from students and parents, that teachers needed to be online 24/7.
And I think we're going to go back to, if you don't mind, I'll ask you on the psychosocial risk in the next round, because I think it's something that it's worth covering. But I would like to ask a question to Oliver, if it's okay. Oliver, can you hear us okay? Yes, brilliant. So in May 2020, around 1,000 workers from STIB exercised their right to stop work, and so they've decided to strike for safety reasons. So perhaps you can tell us how the strike has unfolded and what has happened in detail.
Oui, bonjour à tous. Donc, au mois de mai 2020, plus de 1000 travailleurs, chauffeurs de bus, conducteurs de tram de la STIB ont pour la première fois en Belgique exercé leur droit de retrait pour maintenir des mesures de prévention qui avaient été mises en place et que la direction et que la région voulaient supprimer du jour au lendemain. Ce sont des mesures de prévention qui protégeaient à la fois les travailleurs, mais aussi les voyageurs des transports publics avec une grande fréquence de nettoyage, désinfection, des quotas de voyageurs maximum embarqués dans les véhicules. Toutes ces mesures de prévention avaient permis aux travailleurs de la STIB de traverser courageusement la première vague et de continuer d'assurer cette mission essentielle de transport public. Quand il a été question de supprimer toutes ces mesures de prévention, c'était trop tôt pour les travailleurs et les conséquences sont difficiles. J'ai été touché par le témoignage au niveau des enseignants. Je me retrouve un petit peu dans ce scénario dramatique. On a eu plus de 2000 travailleurs des transports publics contaminés, au moins 2 morts, beaucoup d'agents qui ont été aux soins intensifs. Et donc, voilà, c'est difficile. On a essayé de protéger aussi la société d'une deuxième vague qui a été finalement encore plus meurtrière que la première en Belgique. Donc, ce qu'il faut savoir, c'est que ce droit de retrait qui n'avait encore jamais été exercé en Belgique, il existe déjà dans d'autres pays européens. Et voilà, c'est important parce que je suis très, très fier de mes collègues. On va au tribunal du travail pour la reconnaissance de ce droit de retrait et pour obtenir cette jurisprudence qui protégera mieux demain l'ensemble des travailleurs dans notre pays.
Thank you so much. Thank you. I would actually go for a second round of questions if that is okay. So, Eriko, you've told us the workers in the meatpacking industry, but what about seasonal workers and domestic workers that fall under the umbrella of FS?
Well, when it comes to seasonal workers, this is again another category of workers that has been really hardly hit by the pandemic. I think we have to differentiate when it comes to seasonal workers in the hospitality industry, in tourism. I think this is a sector that is really facing enormous problems. So in general, they suffer with the consequences of the shutdowns, of the travel restriction, of the HoReCa closures, and in general, the whole sector is almost paralyzed still, and the recovery is expected to be very long and difficult. So in this sector, many workers, they benefited from state wage compensation schemes, But let's not forget that this is not the case for everybody. And seasonal workers are definitely some of those that have not enjoyed, in all countries at least, state wage compensation schemes. And this means that when this happened, it means that they could not rely even anymore on that limited income that they were expecting to get during the winter season or the summer season. When it comes to seasonal workers in agriculture, the situation is completely different, because this is a sector that has been defined as essential, as the whole food chain. And what we experienced since the very beginning were a lot of scandals, as it happened in the meat sector, with many real infections, in particular in some countries. And then we faced also the fact that the employers, since the very beginning, they start complaining about labor shortages. And what they were proposing were measures to further casualize work. Like, for example, in Italy, employers were demanding to have for example, additional casualization of work, or some governments, they try to sign agreements with countries outside of the European Union, like Germany with Georgia. But all these measures, they fall short, because at the end of the day, seasonal workers in agriculture, they communicate between them, and they knew that they were not enough protected. And so we still faced labor shortages in some countries, despite the fact that in other countries, like in Italy, for example, there are not really labor shortages, because there are many third country nationals that are already living and residing in the country. Many of them are working, but they are working undeclared. They cannot denounce any violation of their rights without risking deportation, and this is a major problem that we have. And so in general, the sector was not really prepared to deal with this pandemic in agriculture. Let's not forget that this is a sector with a very high level of undeclared work, very, very dangerous. I think it's one of the most dangerous sectors of the economy in terms of accidents at work. In Germany, for example, seasonal workers, they are not covered by Social Security, and this again during the pandemic. So for 70 days, the government decided that they were not covered by any kind of Social Security coverage, including sick pay, and in general, very difficult housing conditions as well. We have many workers, particularly migrant workers, that live really in informal settlements. You can find them in the Manolada region in Greece, in the Foggia region in Italy, in Murcia, in Spain. And can you imagine dealing with the pandemic in an informal settlements where it's impossible to ensure social distancing, where there is no running water, no electricity? So very, very complicated. And when it comes to domestic workers, well, I think there the situation is even dramatic, because these workers, they completely lack recognition in still the vast majority of countries in the European Union, despite they really play an essential role, because they are those that clean our houses, we are those that take care of our beloved ones, we are those that really allow us to socialize and to go to work. They lack recognition. So they are not covered by employment legislation, they are not covered by collective bargaining, by Social Security. So the situation there was really complicated, because during COVID, many employers that are the clients, the households, of course, they were scared. So they didn't want domestic workers to stay in the house. Let's not forget that many of them, they live in the house. So they became, they lost their job and they became homeless on the very same day. Many of them, they suffered an increase in sexual harassment, in violence at work, because people were at home and there was a general increase of sexual harassment and violence, and they suffered a lot of this. Many of them, they don't have any access to vaccination. So in general, a very, very complicated situation. And I think when it comes to domestic workers, what we need is really the ratification of the ILO Convention 189 as soon as possible. There are only 8 countries in the European Union that have done it. And the European Commission need to help us in this respect. We need really a push from the European Union. And then we also need really to ensure that they are recognized as workers, that they have access to collective bargaining, to protective equipment, and to Social Security in each and every country.
Okay, thank you so much. And Martina, I would actually follow up on the intervention that you just made a few minutes ago. So we're now in the 3rd school year with COVID. How has this impacted in terms of psychosocial risks, the education personnel?
Thank you, Bianca. And education, even before the pandemic, was a high-risk sector when it comes to psychosocial risks. This is due to several aspects. First, education as a social activity, so there is a continuous interaction between teachers and students. There is the expectation to manage from the perspective of students and parents, that learn to respect the burden of the outcomes of students, to respect the programs, and in particular, teachers face also a violent environment in many circumstances, and they totally lack any support and training on how to deal with it. In addition, during the pandemic, we had experienced even new form of violence, for instance, cyber violence, cyberbullying, to which both students and teachers sometimes were exposed to. On the impact of COVID on this, I would like just to quote three findings from the Eurofund report, Living, Working, and COVID-19. So according to this survey, during the pandemic, education emerged as the sector where employees reported the highest quantitative demands in their daily work. The second point is that education had the highest level of social isolation for employees during the pandemic. And I wanted to underline that in normal times, education is not a teleworkable profession. So we were not in a new normal, but in a real emergency and extraordinary situation. And according to the same survey from Eurofund, education is the third sector after health and hospitality, where employees feel more emotionally drained by the work. So there were a lot of studies also from our member organizations on the impact of COVID on psychosocial risks. The higher education sector was the most active one. This might be related to the fact that academics are most of the time teachers, but also researchers at the same time. There was in general a main issue of related to the right to disconnect. So teachers and education personnel were connected 24 hours on the whole week, but there was a main lack of support, which we have seen in particular from studies coming from the UK, that the most important aspect to, and I turn to the title of this session, so how can we make work safe in the next pandemic? So the main points that were very helpful for teachers were emotional support. There were some countries that drafted some guidelines on how to also self-improve their own mental well-being. How can we establish some daily practice to keep our mental health safe. So that was indeed helpful. Psychosocial support was also very important, but in most of the countries, this was lacking. And I want to also to make a link with what Enrico was mentioning before, because you mentioned recognition. And recognition was something also very important in the education sector, because if COVID shed light on the important work that teachers were making as frontline workers, still their working conditions, their recognitions, the recognition of the work they did, this didn't change. So even if they were in the spotlight for the hard work they did, this didn't change. A very last point, there were actually also some good, there was a good impact for certain categories of teachers on working from home. These were mostly researchers that for a long time had to put aside their research work, but this is very related to the personal circumstances. They felt a benefit from teleworking where teachers were living in comfortable home working space, but the most difficulties were confronted by teachers with families, in particular with children. Combining the professional life with the family life was an hard task. and in particular for women, because education still remain a high gendered sector, with teachers making around 75% of all the workforce in the education sector. And still today, there is still an imbalance in terms of family responsibilities between men and women, and this for the sector in terms of psychosocial risk for women teachers was particularly challenging.
Okay, thank you so much. Oliver, I would like to go back to you, and because you're health and safety rep, I think the perception of danger is really quite subjective, and it's dependent on how workers are sensibilized on the matter. So what is your role, and how did you sensibilize your colleagues?
Oui, c'est évidemment très important d'avoir l'information pour rassurer les travailleurs. On a essayé de le faire lors de la première vague où en CPPT, on obtenait toute l'information, une transparence et toutes les mesures de prévention qui pouvaient rassurer les collègues. Je ne sais pas si vous vous souvenez, mais à Londres, il y a eu plusieurs dizaines de chauffeurs de bus qui ont perdu la vie au mois d'avril 2020. Et ça a vraiment créé une charge psychosociale très importante au niveau des conducteurs à la STIB en Belgique. On a essayé de mettre en place des mesures de prévention basées sur des analyses de risque. Et donc, ça a bien fonctionné. Pendant la première vague, on obtenait l'information, on communiquait, on mettait en place les mesures de prévention. Ce qui s'est passé, c'est que malheureusement, début mai, il y a eu une volonté de revenir à la normale le plus vite possible. Il fallait que l'économie soit relancée, il fallait que les transports publics refonctionnent à plein régime pour transporter les gens dans les magasins, etc. Et on s'est retrouvé avec des mesures de prévention supprimées sans repasser par l'organe qui les avait mis sur pied, donc le CPPT, sans nous communiquer les résultats des analyses de risque qui permettaient éventuellement de lever certaines de ces mesures. Et forcément, c'est impossible alors pour nous, représentants des travailleurs, de pouvoir rassurer nos collègues, de leur dire que non, ils sont en sécurité, parce que ce n'était clairement plus le cas, et les résultats l'ont montré. Dans la foulée de la suppression de ces mesures, on a eu des centaines et des centaines de contaminations. Alors, j'entendais parler des secteurs essentiels, et c'est vrai que les services publics ont démontré pendant le confinement à quel point on ne pouvait pas s'en passer, contrairement aux grands actionnaires. Alors, c'est clair que pour moi, mes collègues de la STIB font partie des héros de cette crise sanitaire, et je suis tout à fait d'accord sur l'aspect reconnaissance. Là aussi, on en a manqué cruellement. Donc, non seulement les travailleurs de la STIB n'ont pas été protégés comme ils le méritaient, mais et donc, ils méritent beaucoup plus de considération et de reconnaissance pour leur santé, pour leur sécurité de manière générale.
Thank you so much. Thank you. Now, if we can reshuffle for another round of questions, Enrico, future outlooks. So you've depicted quite a grim picture. Has anything changed this year round?
So you want to hear something positive?
Yes, please.
Well,
or at least, some things that you would hope that do happen this year round and some policy learning that we can put in place?
Sure. So I think what has really changed from my point of view, and this is for the all sectors of the economy, is the fact that there is a general awareness of the fact that that things have to change. And this is really very much in the public opinion. And you know, at the end, politics follow very much the sentiments. They follow very much what people think. We are all aware of the fact that we need to change our business model. We need to change the way we produce, the way we move, the way we eat, the way we do tourism. And I think COVID really offers us an opportunity, because in our sectors, it really rings some important alarms. It told us that, for example, you cannot have workers, agro-food workers that are not covered by social security, for example, because at the end you're going to have a public health issue. Because you mentioned the Tönnies factory in Germany. Well, as a consequence of that outbreak, they had to close entire districts, and this was a public health problem. You cannot continue without ensuring really collective bargaining rights and social protection for domestic workers. You need to change the way tourism is carried out, because you need a new model. Because if you have workers that are not covered by state wage compensation schemes, then they run the risk really to go into poverty. And now we have, I think, really an opportunity. We have an opportunity to rethink our society, our world of work. It's the responsibility of the trade union movement to keep high the pressure. And we saw that we need to use this momentum. And we saw that some trade unions at national level have already achieved important results. I mentioned what NGG, our German affiliated union, has achieved in Germany. We have a new social agenda at EU level. This is also the consequence of the strong pressure of the trade union movement. So let's keep using this momentum to really change our society. Everything has to change. In Europe, this means many things. It means, first of all, that we have to finalize, and we need really to adopt the important social policy initiatives that are in the pipeline. I think about the minimum wage directive and collective bargaining. We need really the initiative on due diligence. We need to use this momentum to rethink our economic governance. We need to ensure that we are not going back to austerity, because we saw during the pandemic, if you have to be prepared for the next pandemic, then member states need to have the possibility to invest in health, to invest in protection, in social protection for people. And when it comes to food and farming, if we have to be prepared for the next pandemic, then it means that we need really to think about zoonoses, for example. I mean, if you look at all the diseases, the emerging diseases like Zika, like Ebola, all the pandemic, COVID-19, or the HIV, these are all zoonoses. That means that they are the consequence of the spillover effect from animals to the humans. And this is because of the contacts that we have with animals through wildlife or through intense livestock. So that means completely rethinking our agro-food sector as well. Yeah, and this, in this respect, we have an opportunity. If we will not act, we will not be prepared for the next pandemic. And it's our responsibility as trade union movement to ensure that this is the case, really to protect in particular the most vulnerable ones in our society.
Brilliant, thank you so much. Martina, then, has anything changed after this beginning of the pandemic? Do you think that we're going perhaps into new school closures? What is the situation there?
A very timely question when the new Omicron variant is spreading all around Europe. But to have a bit more the stock of the situation across Europe, ETUI has conducted a study between the month of October and November. So the first thing that I need to underline is that the situation is fast evolving. So information that we have today might not be up to date tomorrow. So we at EU level, and we don't have the capacity to monitor the situation constantly, but we do care of taking some shots of the situation every month. So as of the beginning of November, the majority of educational activity have resumed in presence. Nevertheless, for the higher education sector, forms of online and hybrid teaching still remain the norm. this will become even more relevant right now for the end of the year, as many of our member organizations are asking education institutions and government to resume online teaching, as in-present teaching does not guarantee adequate health and safety measure with the spread of the new Omicron variant. So we for instance, this is a clear demand from our members now in the UK. It's really a latest news from yesterday. So one of the main issue that has concerned education personal rights have been the mandatory measures that many governments at national level applied in order for teachers to perform their job. So we analyzed 42 countries across Europe, so just not countries in the EU, but also Eastern Europe and Central Asia. And among these countries, and I will put you the link of this study in the chat, around half of country impose mandatory measure for teachers. We have example of country imposing COVID-19 pass, so either being tested or being vaccinated or recovered from COVID-19. But we do also have 9 countries, namely Albania, Armenia, Estonia, Hungary, Kazakhstan, Kyrgyzstan, Latvia, Tajikistan, and Ukraine, that impose mandatory vaccination for teachers. So our member organization have always stand for teachers to be prioritized in the vaccination plans. At the same time, it's clear that the right to be vaccinated or not needs to stand to the individual rights. And among these countries imposing mandatory vaccination, several of them impose redundancy or salary suspension in case of non-adherence to this measure. So this was one of the stricter measures that is now in place for teachers in terms of right. Looking at the future, we can expect for the current school and academic year that there will be a constant switch on and switch off between in-present teaching and online teaching. So the more and more hybrid teaching as well. And this is also something that we experience here in Belgium. As soon as a positive case is detected in the same education environment, the whole class moved to quarantine for 7 days. So you can imagine the level of uncertainty that this creates also for teachers, that needs to be all time prepared to both type of teaching.
Yeah, well, of course, also because as you were mentioning beforehand, the switch is quite problematic.
Yeah.
Oliver, similar to the other panelists, I would like to ask you if has anything changed this year in your sector, and if there is some policy learning that can be put in place?
J'aurais aimé vous annoncer de bonnes nouvelles aujourd'hui. Malheureusement, il y a rien qui a changé au niveau de l'entreprise. Les infractions à la législation continuent. On n'est plus écouté en CPBT, il n'y a plus aucune transparence. Et donc, ce qui est important, c'est on a été les premiers en Belgique à exercer ce droit de retrait, et on a quand même le sentiment que quoi que l'employeur fasse aujourd'hui, eh bien, ce serait une façon de légitimer le droit de retrait. C'est difficile d'expliquer ça, mais alors que le droit de retrait devrait s'exercer là où il n'y a pas de représentation syndicale, là où un employeur met en danger la vie et la sécurité de ses travailleurs. Voilà, c'est à la STIB, le plus grand employeur à Bruxelles, qu'on a dû le faire. Et on a vraiment le sentiment que si la sécurité, la santé des travailleurs devront de nouveau être des priorités, eh bien, ça passera par une condamnation de la STIP au tribunal du travail. Parce que il y a depuis ce droit de retrait, il y a aucune de nos demandes n'a été prise en compte. Le mépris pour la sécurité, la santé des travailleurs est toujours aussi fort. Alors vraiment, je voulais remercier Laurent Vogel qui nous a apporté son soutien depuis le début, Isabelle Schaumann de la CES. C'est très important pour nous dans ce combat où vous avez la STIP qui a engagé un des cabinets d'avocats les plus chers à Bruxelles pour cette procédure. C'est très important pour nous d'avoir le soutien de l'ETUI, de la CES. Ça nous donne beaucoup de courage, d'abord pour améliorer les choses à court terme au sein de l'entreprise, mais aussi pour aller chercher cette jurisprudence pour le droit de retrait en Belgique.
Thank you so much, Oliver. Thank you. So I would like to hand over the word to Tony, if this is okay with you. So looking at the European level, if that's okay. So it's particularly on the OSH legislation for the Biological Ages Directive. The aim of this legislation, as some of you may know already, is really to protect workers from the biological risk at work. Is this directive really fit to handle the pandemic? And if not, what could be improved?
Alors, effectivement, Bianca, c'est une véritable question. On a au niveau européen une législation donc, qui s'appelle la directive agents biologiques et dont l'objectif est de protéger les travailleurs contre les risques biologiques, les agents biologiques. Ça peut être des bactéries, ça peut être des virus. Et donc, cette législation est en place, elle existe, elle a été adoptée au niveau européen, elle a été transposée dans tous les États membres, mais la question, effectivement, c'est de savoir est-ce qu'elle est adaptée dans une situation de pandémie. Et ma réponse, elle est simple, et je crois que de nombreux syndicalistes seront d'accord de dire que non, cette législation n'est pas du tout adaptée à une situation de pandémie. Elle a été adoptée il y a plus de 20 ans. Et en fait, cette législation, elle couvre les travailleurs qui ont une intention délibérée de travailler avec un agent biologique. C'est par exemple les laboratoires ou les instituts de recherche. Donc, c'est dans cet esprit-là que la directive a été adoptée. Donc, en gros, pour l'industrie pharmaceutique, les labos d'analyse médicale. Alors, on mentionne également dans cette directive les gens qui travaillent dans le traitement des déchets, par exemple, qui peuvent également être confrontés à des risques biologiques. Mais en fait, cette législation n'est pas du tout faite pour gérer une situation de pandémie. Alors, la question, évidemment, c'est comment est-ce qu'on peut améliorer cette situation? Et je crois que c'est une demande syndicale qui est forte, c'est de modifier ces législations. Et tout simplement, la première chose qu'il faudrait faire, eh bien, c'est de prévoir les situations de pandémie dans cette législation. Donc, qu'est-ce que c'est en fait une situation de pandémie? C'est en fait tous les travailleurs, quel que soit le secteur, et ici on a vu des exemples de 3 secteurs, mais on peut en citer beaucoup d'autres, où tout le monde, finalement, est confronté au même risque biologique. Et donc, cette situation-là, malheureusement, elle n'est pas encore prévue dans le texte, et donc il faudrait l'introduire. Et alors, on a bien entendu, j'ai écouté attentivement les 3 intervenants, et ce qui m'a frappé, c'est que chacun a souligné la non-préparation des différents secteurs. On n'était pas préparé à cette pandémie, et s'il doit y avoir une nouvelle pandémie, eh bien, cette non-préparation ne peut plus être. Il faut aujourd'hui être prêt à affronter une éventuelle nouvelle pandémie avec un virus qui peut être totalement différent. Enrico a parlé de zoonoses, des maladies qui sont transmises des animaux à l'homme. Donc, il faut prévoir un peu toutes les situations. Et l'idée, et je crois que ce serait un élément essentiel dans cette directive, ce serait d'introduire un plan temporaire d'urgence en situation de pandémie. C'est-à-dire que chaque entreprise soit prête à mettre en place des mesures s'il devait y avoir une nouvelle pandémie. Et évidemment, ce plan, il va varier d'une entreprise à l'autre parce que les situations sont très, très différentes d'un secteur à l'autre. Et donc, ce plan doit être négocié avec les travailleurs de l'entreprise qui connaissent bien leur travail et autres, entre les représentants des travailleurs et les employeurs, et ils doivent mettre ce plan d'urgence qui est temporaire, qui ne serait activé qu'en cas de pandémie. Eh bien, il faudrait que toutes les mesures qui soient mises en place dans ce plan soient négociées et prêtes et discutées entre les travailleurs et leurs employeurs. Alors, qu'est-ce qu'il peut y avoir dans ce plan, brièvement, parce que je ne veux pas être trop long, mais est-ce qu'on peut faire du télétravail ou pas? Ça, c'est une question importante. On a vu que dans le secteur de l'éducation, ça pouvait être très, très compliqué de faire du télétravail. Comment est-ce qu'on peut réorganiser toute l'organisation du travail afin de minimiser ces risques biologiques? Et ça va dépendre, les mesures vont dépendre d'une entreprise à l'autre. Ça va complètement être différent dans le secteur de la viande ou dans le secteur des transports. Les mesures vont être complètement différentes. Comment est-ce qu'on va tenir compte également des autres risques? Parce qu'il n'y a pas que les risques biologiques. On a parlé des risques psychosociaux qui sont également augmentés en situation de pandémie, mais il y a également les risques chimiques qui sont augmentés. Tous les produits qu'on utilise pour se désinfecter les mains, ce sont des produits qui ne sont pas anodins non plus pour la santé des travailleurs. Je crois que Oliver a beaucoup insisté sur le fait qu'il fallait insister sur ce droit de retrait des travailleurs en cas de danger grave et imminent. Et c'est clair que cet élément-là est essentiel et doit être inclus dans un plan d'urgence en cas de pandémie. Il faut prévoir la situation pour les travailleurs, de dire « je ne vais pas travailler, c'est trop dangereux pour ma santé ». Et ça, l'employeur doit pouvoir le reconnaître. Ce droit de retrait existe en France, il est exercé. En Belgique, malheureusement, il va falloir passer par un procès, je l'espère, pour pouvoir le faire reconnaître. Et donc, voilà des choses qu'il va falloir mettre dans ce plan d'urgence en situation de pandémie, qui devrait être activé par les travailleurs et les employeurs après une discussion, et qui ne pourrait s'arrêter que lorsque la pandémie est arrêtée. Donc voilà, ça c'est des choses qu'il faut absolument changer, et c'est la raison pour laquelle les syndicats réclament d'urgence une révision de la directive agents biologiques pour qu'elle prenne en compte les situations de pandémie.
I actually have a follow-up question on this, if you don't mind, right from the bat. Is there the political will to make this happen, do you think?
Alors, malheureusement, on a vu, et vous savez que toutes ces questions sont discutées au sein du comité consultatif de Luxembourg pour la santé et la sécurité au travail, et je crois qu'il y a de nombreuses personnes qui nous suivent, qui sont membres de ce comité, et malheureusement, les discussions sont très difficiles là-bas, parce que les syndicats sont les seuls à réclamer ce changement dans la directive agents biologiques. Les employeurs ne sont pas preneurs. Leur argument, et on en a discuté hier pendant la première partie de cette conférence, c'est de dire que c'est un problème de santé publique. Et ça doit être réglé par la santé publique. Nous disons non, la pandémie, c'est également un problème de santé au travail. Je vais juste citer une étude de l'Institut Pasteur à Paris qui montre que, en fait, quelles sont les raisons de de contamination au Covid. Il y a le cercle familial, hein, où on est en contact permanent avec les personnes de son entourage. En deuxième position, c'est le travail. Pourquoi? Parce qu'on passe énormément de temps les uns à côté des autres et voilà où peuvent se faire les infections. Hein. Donc il est important de vraiment modifier cette directive. Les États membres ne sont pas preneurs. La raison est qu'ils veulent maintenir les activités. Hein. Et ils ont, je crois, trop peur qu'avec des mesures de protection peut-être trop strictes, on freine l'activité économique. Je crois que le nœud du débat, il est là. Mais malheureusement, comme on le dit souvent dans notre unité, notre santé, la santé des travailleurs n'est pas à vendre. Okay? Et donc, c'est quelque chose qui est primordial et qui doit être préservé.
Brilliant. Thank you so much, Tony. I have a question from the audience for each one of you. And then if you would like to ask more questions, just, of course, you can just drop them in the Q&A at the bottom of your screen. So the first question is for Enrico. I'm going to read it out because it's a lengthy one. I'm sorry about this. So you said something about seasonal workers and the fact that they're not normally covered by Social Security. How the exclusion from the scope will impact these workers from the case of long COVID and COVID recognized as an occupational disease?
Well, first of all, it depends on the country. We have the situation, the country where they are not covered are, for example, Germany and Romania. Yeah? When it comes to seasonal workers in agriculture, when it comes to seasonal workers in the hospitality sector, it is much broader. And it is a major problem. By the way, in the new coalition agreement of the German government, there is the commitment to end this. And this is a very good news. So there is the commitment to ensure at least sick pay coverage from day one. And it is a major problem because then it is, as experience showed, when this becomes most of the time a public health issue, yeah, because workers, they are completely not protected. And at the end of the day, this becomes a problem for the community where they live and where they reside. So in terms of longer term COVID, well, the problem would remain the same. I mean, they are not covered, they don't denounce. We have cases also in the agriculture sector where we had farm workers that died because of COVID. We had experienced, for example, a new word, which is work quarantine. So the fact that considering the fact also that they are not covered by Social Security, in some countries, again, in Germany, they had to work, but they didn't have to have any contact with the external, yeah, to limit any risk. This means also that from the trade union side, they couldn't access to them, they couldn't inform them about their rights. And in the cases where they fall sick, well, they are not covered by any sick pay and they stay in the country of destination. They are not even allowed to go back to their country of origin when it comes to seasonal work. So this was really a major problem that we had to face during most severe parts of the pandemic. And lently, we can say that there are some governments that are taking action to change this, but still at a very, very slow pace, unfortunately. So it's a major problem. And just to comment briefly on what Tony said, I think we need this initiative. We need this initiative as soon as possible, because when it comes to the meat sector, for example, we also have major problems related really to the work environment. So they got infected because they were forced to share accommodation, they were forced to carpool because very low wages and they couldn't allow anything, they couldn't allow to have better accommodation, for example, but also because they worked in close proximity one another. And also because the employer didn't want to stop or to slow down the speed line of the production. And this made them to work really in close proximity, most of the time in old plants with bad ventilation systems. So we have to look at work environment, factory layouts, work ventilation, and this would be part, from my point of view, at the urgency plan that you have mentioned. But without social security, without strengthening collective bargaining, without ensuring the right to organize and bargain collectively, then we cannot have that kind of urgency plan that you have mentioned, because in many sectors, unfortunately, the situation is so precarious still and there is such a huge turnover of the workforce that there would be anybody probably to negotiate those kind of urges. So we need to complement this still with social policy measures that really address the problem that we have in some sector, which is strengthening collective bargaining and ensuring the right to organize for everybody.
Brilliant, thank you so much. And Martina, I have a question for you coming from the audience. So what is done currently in the education sector to protect the teachers in the current wave? And according to you, what should have been done differently, and how can we learn from what has happened?
Is the question related to what has done from the trade union perspective, from the governments at education institutions? So the question can be declined with several perspectives. At the moment, there are countries where, and I would stress on the aspect of collective bargaining and social dialogue, because something which also related to what Tony said for the urgency plan, where mandatory measures are taken, these measures have not been discussed with education trade unions. So what is being done? Education trade union continue to provide support to teachers, legal advice, and they struggle to negotiate with education ministries and health ministry. We have one of the latest example coming from Romania, where there was an attempt from the government to impose to teachers the burden to test on a 2 times per week all the students, and there are education institutions with over 3,000 of students. So this is totally outside the competences of a teachers, outside their job description, without mentioning the impact that this could have on their daily working from an educational perspective. So we have some good example. In this case, in Romania, education trade union managed to strike an agreement with the government. So in the end, in this case, for instance, now there is an appointment of teachers responsible in the education institutions who distribute the tests to the families so that parents can make the tests to the students regularly. So that was, for instance, an example of a winning case for the perspective of education trade union. At the moment, our concern is still high with regards to health and safety measure. Education trade unions believe that governments in particular are still not doing enough for ensuring health and safety, but also for ensuring the conditions to run online and hybrid teaching. We have had also other cases, for instance, of mass distribution of digital tools and equipment and to improve internet connection in education institution. But on a general basis, still this doesn't ensure a smooth running of the activity. So we're still lagging behind, unfortunately.
Thank you. Oliver, I have a question for you. If this, sorry, I need to read it out. So if, sorry, I can't make anything. Let me rephrase this. Martina, I have another question for you. Oliver, I'll get back when I actually have the chance to read the question properly. Tony, sorry about this. So you did mention that there are, from the experiences that you both three mentioned as interveners, there are differences between these sectors. How can you put these differences together and make sure that a directive is effective for all sectors?
Alors, en fait, la directive agent biologique, elle est calquée sur évidemment les principes de la directive cadre en santé et sécurité, donc la directive de 1989, et tous les principes sont déjà là, en fait. Hein. Et donc, il y a une hiérarchie de principes qui sont déjà définis et qu'il suffit de suivre, mais qui doivent être évidemment adaptés à la situation de chaque entreprise. Le risque biologique, il n'est pas très différent dans ce sens-là que les autres risques qu'on a au travail. Évidemment, ça dépend toujours de la situation de l'entreprise dans laquelle on se trouve, de l'organisation dans laquelle on se trouve. Mais je crois que ce qui est important, c'est de suivre les principes généraux, c'est-à-dire d'essayer d'éliminer le risque si c'est possible. Et ça, c'est par exemple le fait qu'on peut, dans certains cas, vraiment soustraire le travailleur du risque, par exemple avec le télétravail. Hein, là, on est chez soi et donc on diminue le risque. Ça, ce n'est pas possible dans tous les secteurs, on l'a encore dit. Mais il y a également tous les systèmes, la protection collective avant la protection individuelle. Et par exemple, il n'est pas normal, comme on l'a vu dans de nombreux secteurs, qu'on fournisse juste des masques aux travailleurs. Ce n'est pas suffisant. Il faut repenser le travail avec d'abord l'organisation collective. Est-ce qu'on peut s'arranger dans le secteur de la viande pour mettre moins de personnes sur la chaîne de production, pour les éloigner les unes des autres, donc pour réorganiser le travail en suivant les principes de la directive cadre. Donc, je crois qu'effectivement, les situations très clairement divergent d'une entreprise à l'autre, mais on a déjà dans la directive agents biologiques, tout n'est pas acheté dans cette directive. Il y a déjà des principes qui sont établis, qu'il faut suivre, mais avec, si je peux le dire, les lunettes d'une pandémie.
Yeah, brilliant. Thank you so much. So, Oliver, I have a question for you. Do you think that this trial has changed in any way the way that your employer behaves towards you as workers? And do you think that this trial will have impact for other sectors as well?
Bon, je l'ai dit tout à l'heure, il n'y a pas d'évolution positive. La situation, elle est toujours très, très compliquée. Les mesures de prévention qui devraient être prises ne le sont plus. En Belgique, il y a un seul endroit où les distances de sécurité ne sont pas respectées. Ce sont les bus, les trams, les métros où ces véhicules peuvent être pleins à craquer. On ne comprend pas très bien toujours les logiques. Donc, est-ce qu'on peut être contaminé en discothèque? Certainement, mais est-ce que des bus, des trams et des rames de métro pleines à craquer, est-ce que en temps de pandémie, c'est quelque chose qui est acceptable? Nous, on est convaincus à la STIP que le transport public est un vecteur de contamination. On est certain de ça. Maintenant, pour que l'employeur accorde plus d'importance à la sécurité et à la santé des travailleurs, je le regrette profondément, mais je pense que ça passera par une condamnation au tribunal du travail pour se rendre compte qu'il y a une législation, un code du bien-être au travail à respecter, des prérogatives du CPPT à respecter. On est très confiant pour l'issue de ce jugement. D'abord, on a choisi une des meilleures avocates en Belgique, Maître Remouchant, mais le dossier, il est solide. La STIB a reçu des avertissements de l'inspection contrôle du bien-être pour avoir commis des infractions à la législation. Voilà, j'aurais aimé vous dire aujourd'hui qu'il y a des leçons très positives qui ont été tirées, que la santé et la sécurité des travailleurs de la STIB, c'est de nouveau une priorité pour l'employeur et qu'on peut être un modèle à la STIB de cette concertation sociale et de la prévention, mais malheureusement, ce n'est pas le cas du tout.
I think last year you in the OSH conference, you did mention that labor inspections didn't happen throughout the pandemic at all. this is a question for all of you, has the situation changed now that we're, a few months in the pandemic, or is it still something that is completely lacking? You
Sure.
can.
Okay, so when it comes to our sectors, if you think about agriculture or domestic work, it is even more complicated because agriculture is carried out in rural areas, so you have very small or micro companies. It's not like going to a processing industry where you find a lot of workers in the same workplace. So inspection are already complicated from that point of view. In the domestic work sector, even more because they should carry out inspection in the houses. And during the pandemic, indeed, we saw even less inspection. So inspections, labor inspectors have been dismantled in Europe because of austerity measure, and this is a huge problem that we have. And throughout the pandemic, even more. So less inspection, less possibility for trade unions to assess workers, particularly in our sectors. And is the situation improved? Well, inspection have started again a bit. We can say that we see some countries like in Italy where they are investing in having more labor inspectorates, but overall, we will be back to a situation which was already problematic before the pandemic. So it was problematic, extremely problematic during, and it is going to be problematic again. And by the way, just to close on this, we achieved an important victory, which is a social conditionality in the common agricultural policy, which is a very important principle because it means that the money allocated through the CAP, which is a third of the EU budget, should not go basically to employers that do not respect workers' rights, including in particular 2 directives on health and safety. But the whole system relies on labor inspectors. It relies on the inspection that are already carried out by competent authorities. And if the level of inspection remains so low, then we're going to have a problem because an important tool like the one that we have achieved with social conditionality run the risk to not work in practice. So this is an additional reason for us why labor inspectors have to improve and why we demand even a EU directive on labor inspection to increase the powers, to increase the frequencies of labor inspectors and to really ensure common standards across the European Union.
If any of the panelists would have anything to add, you can just jump in.
Yeah, I would say the situation really varies on the countries. We also have for the education sectors, as Enrico mentioned before, there are also differences within the same countries between rural area and areas in the cities. We have, for instance, been working also at EU level a lot from the perspective of risk assessment, which is an obligation of employer, but still what our member organizations point out is that these are not adequate tools, in particular in the period of the pandemic. So we should work on reframing these tools to make sure that we can really counter the difficulties that we face during a pandemic period. And I think that I go back to what Tony was again mentioning before. I mean, the idea of including an emergency plan in this respect, it's crucial. But at the same time, we need a strong social dialogue and collective bargaining in countries. And as the data from our study showed before, this is lacking if you consider that mostly 80% of education trade unions are not even consulted when it comes to taking measures on occupational health and safety.
Thank you. Tony, I think you wanted to add something.
Oui, je voulais juste dire que en fait cette pandémie a révélé toute une série de dysfonctionnements qui préexistaient en fait à la pandémie. Et Enrico a par exemple mentionné tous les problèmes qu'il y avait avec la sous-traitance dans la chaîne alimentaire. On a également parlé avec Martina de la charge psychosociale des enseignants qui était déjà lourde avant la pandémie, mais qui s'est aggravée avec la pandémie et le fait qu'il fallait donner cours à distance à des étudiants. Eh bien, pour les inspecteurs du travail, c'est la même chose. Avant la pandémie, il y avait déjà un manque d'inspecteurs du travail qui a été criant pendant la pandémie. Ces personnes n'étaient pas là pour constater des problèmes dans les entreprises. Donc, c'est clair que si on veut être mieux préparé à une prochaine pandémie, mais si on veut également, de façon générale, améliorer les questions de santé et de sécurité au travail, il faut renforcer ce pan et avoir plus d'inspecteurs du travail, c'est une évidence. Alors, on a cette demande qui est d'avoir au moins un inspecteur pour 10 000 travailleurs. Dans certains pays où on en est très très loin, c'est un inspecteur pour 30 000, pour 40 000 travailleurs, c'est totalement insuffisant.
I imagine, Oliver, you would depict a grim picture as well for the STIB workers in Belgium. I took a tram this morning and it was jam-packed. Do you think there are labor inspections do happen in your sector here in Brussels and in Belgium, or is it something that it's still lacking, like the other intervenants mentioned? Oh no, I think you have to unmute yourself first. Thank you.
Donc nous avons sollicité l'inspection contrôle du bien-être. Ils sont intervenus assez rapidement. Ils ont adressé un avertissement à l'employeur. Ils ont constaté des infractions à la législation dans le chef de la STIB. Ils ont fait leur travail. Maintenant, ce qui est effrayant, c'est que même les recommandations où les avertissements de l'inspection contrôle du bien-être ne sont pas suffisants pour faire réagir la STIB. Et ça, je pense que ce n'est pas propre à la STIB. Il y a d'autres employeurs qui banalisent un petit peu ou qui ne prennent pas au sérieux les avertissements de l'inspection. Mais je suis tout à fait d'accord avec ce qu'a dit Tony. De manière générale, dans notre pays, et les syndicats le disent depuis des années et des années, que ce soit l'inspection du contrôle des lois sociales ou l'inspection contrôle du bien-être, ils sont en sous-effectif dramatique par rapport au nombre de dossiers à gérer. C'est tout simplement impossible pour eux d'intervenir dans des délais acceptables. Alors ils partent au plus pressé, ils font les urgences, mais si on veut avoir une vraie politique de prévention dans notre pays, ça passe aussi évidemment, comme Tony l'a dit, par un renforcement de ces services tellement importants.
I have a final question coming from the audience that might be a bit controversial, but I'll pose it to you as it was written. So what is your view on prioritizing occupational groups for vaccinations and vaccination boosters? So we know that the healthcare sector has, received their boosters before any other sector is. Would you agree with this approach? What about teachers? What about the workers in the meat sector? What about transport workers? Or is it something that should have been done differently? I think you have a strong will to start, Martina. Go for it.
It was indeed a controversial topic and was very difficult to take a stand. At the end, for the period, we talked a lot about prioritization for the first jab of the vaccination campaign. So we were back in March 2021. The majority of our member organizations supported the prioritization of teachers in the vaccination campaign in order to let education going back to in-presence teaching. It can be argued that there are more important sector than education, which is true. At the same time, the educational loss in terms of outcomes of students will be just analyzed in a few years. So we are not really seeing at the moment the impact of COVID on learning outcomes of students. At the same time, there were member organizations that decided not to support the prioritization. First, because when you administer a dose for a category, you are excluding other categories. So there were countries, some unions, for instance, in Germany, decided not to support the prioritization for the common for the common interest of the nation, because they thought there were other sectors that were that should have benefited from the vaccine first. At the same time, there were other countries where anti-vax workers were dominating. So there were other countries where education trade union decided not to take a stand in favor of vaccination. For us, at European level, of course, it's a very contradictory topic. It's very difficult for us to take a stand. I've also been participating at several meetings at the confederation level. For them, it's even more difficult, right? But yes, I mean, we don't need to forget the component of the national context, and sometimes even the regional context. So any case should be analyzed based on their specificity. So that's crucial. And we cannot, at least for the education sector, and Enrico was mentioning before, for instance, you were calling for an EU action, harmonized action from the EU. Well, this is not possible for the education sector, where the competence still remain at national level. What's more, there are discrepancies between what's competence of education trade unions and to which extent we can put forward our demands on health and safety, and when we are deconfining into the domain of health. So any case needs to be analyzed with their national specificities and regional specificity, and any measure, what we always said, that any measure regarding vaccinations need to be negotiated between national governments and trade unions.
Brilliant. I think we only have a few minutes, but if anyone else would like to jump in on this, feel free.
Well, what I can say is that this was an important question that we had, of course, last year in particular, when the vaccination campaign started, as together with the employers in the agro-food sector, we even addressed a letter to the European Commission, clearly asking for prioritization of agro-food workers. We made clear, of course, that this didn't have to be a problem for other important essential category of workers, in particular medical doctors and all the health personnel that from our point of view really had the first priority. But I must say that we didn't see in any of the countries a prioritization given to agro-food workers. This didn't happen, at least from our knowledge at the moment. And a major problem that we face in our sectors is the fact that undocumented migrant workers didn't have any kind of access to vaccination. Only in some countries, undocumented migrant workers, they have access to vaccination. There are some good examples in some regions in particular as well, but still in many countries in the European Union, undocumented migrant workers, they don't have any access to vaccination. And we talk about, again, public health, and I think it's really important that everybody has access to vaccination. So this remains, let's say, a priority for EFAT when it comes to vaccination, really ensuring that it covers all the workers employed in our sectors.
Brilliant, thank you. Tony, do you have anything that you would like to add on this?
Non, peut-être juste mentionner le fait que, évidemment, la vaccination doit être faite en bonne entente avec les acteurs de la santé publique. Je crois que c'est important également qu'on fasse ça de façon ordonnée. Donc, il est normal que les personnes qui soient les plus à risque soient prioritaires. C'est un principe que je pense que tout le monde peut accepter.
Brilliant, thank you. Oliver, if you would like to add anything to the debate, otherwise I think we can give the floor to Paula.
Mais écoutez, en tout cas, à la STIB, on est globalement, on peut pas soutenir l'idée d'une vaccination obligatoire, par exemple. On a entendu qu'en Italie, sur 2000 membres du personnel soignant non vacciné, quand le gouvernement a décidé de l'imposer, eh bien, ce sont 1500 médecins et infirmières qui ont fait le choix de quitter le domaine des soins de santé. Ça, en Belgique, ce serait absolument épouvantable, hein. Donc, les hôpitaux sont déjà à saturation complète. Les soins intensifs sont débordés, il y a un manque de personnel et si on perd quelques centaines ou quelques milliers d'infirmières à cause d'une obligation vaccinale, ce sera tout simplement ingérable. Et ça, ce sont les syndicats du secteur eux-mêmes qui le disent. Donc, voilà.
Brilliant. Thank you so much. And thank you for all of you for contributing to the panel this morning. I'll give the floor to Paula so that she can tell us what's going to happen for the rest of the day.
Thank you, Bianca, and thank you very, very much to the panelists for sharing the insights from the different sectors and highlighting that strengthening occupational health and safety is essential when we are talking about preparedness for future health pandemics. And also thank you to Tony to really bringing home the message that it is time to revise the Biological Agents Directive that the EU has. Now, we will now have a 30-minute break, after which there is a slight change in the agenda. So at 11:30, we will start with an interview with Annemieke de Groot on long COVID. After that, we will discuss further the workplaces in the pandemic. So we will see you back at 11:30. Thank you very much.
Oh, thank you.
Yeah. Thank you.
Okay, welcome back to the ETUI Annual Occupational Safety and Health Conference for our final session. And we're very pleased to have with us now Annemieke de Groot from C Support in the Netherlands, who will be discussing with Marian the issue of long COVID and the difficult return to work. Marian, over to you for the interview.
Thank you very much, Paula. And I will speak in Dutch now, so I will be translated as of now. Annemiek, welkom.
Dank je.
We zijn erg blij om je te hebben hier. Je bent last minute ingestapt om een andere collega, een auteur van de HESA-macht, te vervangen. En het is fantastisch dat we jou kunnen hebben. We gaan het over long COVID patiënten hebben en hun moeilijke terugkeer naar werk. In Nederland is er een organisatie die deze mensen begeleidt. En dus we gaan het hebben over die organisatie waar jij bestuurder-directeur van bent, zou ik maar zeggen. En we gaan het ook hebben over de mensen zelf. We gaan dus eigenlijk naar het, niveau van de workplace. Ja, en van de individuele werker, hè, de individuele ondernemer. Dus om te beginnen, misschien is het goed als je eerst even iets vertelt over die organisatie C-Support. Dat we daarmee beginnen. Daarna komen we vanzelf op de mensen om wie het gaat. C-Support, wat is de historie? Wat is de achtergrond?
Ja. Nou, Marjan, allereerst wil ik jullie hartelijk danken, ondanks dat het korte termijn is geweest. Ik vind het een eer om hier te mogen zijn en om in Europa een aantal mensen toe te spreken om wat te vertellen over ons werk, wat ook wel heel speciaal is. C-Support is vanaf vorig jaar 1 oktober werkzaam in Nederland. En wij hebben onze roots, onze wortels, zijn gevestigd in de Q-koorts-epidemie. Q-koorts was een hele grote epidemie die een aantal jaren in Nederland gewoed heeft. En Q-Support is destijds door het ministerie van VWS, Volksgezondheid, in het leven geroepen om patiënten te adviseren, te begeleiden en om onderzoek te verrichten. Daar zijn wij in 2013 mee gestart. Dat hebben we naar volle tevredenheid gedaan. En in navolging op dat werk hebben wij ook de begeleiding voor long-COVID-patiënten op ons mogen nemen in opdracht van het ministerie van Volksgezondheid. Wat ik belangrijk vind om te vertellen is dat de lessen uit de Q-koorts de basis hebben gelegd voor dit werk. Want wat wij zagen, we startten in 2013, toen waren al heel veel mensen heel diep gezonken, waren hun baan kwijt, waren hun bedrijf kwijt, zaten in de bijstand, zaten echt heel diep in de problemen, juist omdat ze die begeleiding in de eerdere jaren niet gehad hadden. Dus nu COVID kwam, hebben wij gezegd, we gaan, minister, denk eraan, laat dit niet meer gebeuren. Wacht geen jaren om mensen, en dan denk ik ook met name naar het thema van vandaag, goed te begeleiden, met name bij werk, maar ook bij medische vraagstukken. Want dat is wat wij doen. Mensen melden zich aan, ze krijgen individuele support, begeleiding, op alle leefgebieden waar zij problemen ontmoeten, ten gevolge van hun ziekte. Dat kunnen medische vraagstukken zijn, werk, psychosociale vraagstukken, financiële vragen, maatwerk per patiënt. We geven ook heel veel scholing. We bemoeien ons met onderzoek. We adviseren daarover. maar de patiënt en zijn of haar problemen staan centraal.
Ja, het is, ik hoor je, ik vind het heel interessant wat je zegt. Eigenlijk die organisatie C-Support, COVID-Support, is gebaseerd op de eerdere epidemie, dat weliswaar geen pandemie was, maar het is dus eigenlijk een les die getrokken is uit de epidemie. Dus dat wat natuurlijk ook een van dieren op mensen overdraagbare ziekte is. Ja, en ook met hele nare gevolgen. Als je nou kijkt naar de toen en nu, dus je kijkt naar de Q-koorts begeleiding die jullie toen gaven en de C-support nu. Je zei al van de mensen toen met de Q-koorts, die waren eigenlijk al heel diep gezonken. Nu waren jullie er eerder bij. Wat heeft dat opgeleverd?
Nou, weet je wat het uiteindelijk oplevert, kunnen we pas over een aantal jaren zeggen. Maar wat wij zagen bij de Q-koorts was dat je juist rondom de heel complexe wet en regelgeving, dat mensen het, als ze ziek zijn, ook vaak niet zo goed alleen kunnen. Dat ze een stukje support, begeleiding, de weg wijzen in het ingewikkelde landschap. Dat ze dat heel hard nodig hebben. Bij de Q-koorts zagen we dat het soms op details aankwam om die wet en regelgeving goed te volgen, om daar niet veel later mee geconfronteerd te worden met de gevolgen daarvan. Dus wat wij nu doen is al heel vroeg mensen terzijde staan. We gaan met mensen naar hun werkgever wanneer die vragen heeft. We schakelen tussen de bedrijfsarts en de huisarts. We wijzen de weg in mogelijk goede behandelingen die er zijn. We helpen de mensen bij het invullen van de dagrapporten zoals dat in Nederland werkt. Maar dat is in ieder land anders, hè, de wet en regelgeving. Maar we doorlopen met de patiënt de stapjes om te voorkomen dat hij over 2 jaar niet denkt van, had ik het toen maar anders gedaan.
Even nog één vraag meer over het algemene beeld. En dan wil ik gaan inzoomen op de mensen om wie het gaat. Je hebt me ook iets gezegd over aantallen. Hoeveel mensen jullie tot nu toe al hebben aangemeld gekregen. En veel van die mensen hebben vragen op het gebied van werk.
Ja, nou de getallen zijn indrukwekkend. Als je me dit een jaar geleden gevraagd zou hebben, dan had ik het niet geloofd. We gaan inmiddels over ruim 9000 patiënten die wij gezien hebben. Long-COVID-patiënten zijn allemaal mensen die 3 maanden of langer klachten hebben. Dat is het topje van de ijsberg, want we zien ook heel veel mensen met bijvoorbeeld migrantenafkomst. Mensen in de achterstandswijken, die zien wij niet. En dat is nog wel een zorgpunt voor ons. Daar zijn we ook stevig op aan het investeren. Meer dan 9000 mensen, waarbij er zeker 6000 mensen problemen of vragen hebben rondom werk. Dus werk en inkomen is een heel belangrijk thema bij ons.
Ja. En je zegt dat die 9000 zelfs het topje van de ijsberg zijn. Dus dat betekent dat we... Kunnen we dat dan vermenigvuldigen met een factor? Of, ja, dat is natuurlijk moeilijk te zeggen, maar want ik vind het een indrukwekkend aantal mensen die zich ook daadwerkelijk aanmelden bij zo'n organisatie. Betekent trouwens ook dat jullie je goed bekend hebben gemaakt, denk ik.
Ja, terwijl dat nog wel een zorgpunt was, want je moet, vraag en aanbod moeten hand in hand gaan. En we hebben natuurlijk alle zeilen bij moeten zetten om die grote aantallen aan te kunnen.
Ja. En dan gaat het dus om mensen die 3 maanden of langer COVID hebben. Hè? Dus in eerste instantie, als je zich eerder aanmeldt, dan zeg je van zie het nog even aan. Maar 3 maanden of langer, dan heb je het toch echt wel over long COVID.
Ja. Maar misschien even voor de aantallen van wat eigenlijk de verwachting zal zijn. Het onderzoek ten aanzien van SARS laat zien dat 1% langdurig, en langdurig, dat is echt langer dan een jaar of 2 jaar, klachten overhoudt. Dat zagen we bij de Q-koorts ook. Maar zelfs al neem je 1% van het aantal besmette mensen En als dat 2 miljoen is, dan is dat naar rato ook 20.000 mensen zijn het die lange termijn klachten houden.
Ja.
Dus dat getal is echt zorgwekkend.
Ja. Een klein percentage van een heel groot aantal zijn ook heel veel mensen. Ja, hetzelfde geldt natuurlijk voor de opnames in de ziekenhuizen en op de IC's. Een klein percentage mensen komt in het ziekenhuis. Maar omdat dit zo'n besmettelijke ziekte is dat een heel groot aantal.
Ja.
Dus dat is vergelijkbaar. Als we het nou hebben over, gaan we inzoomen op die mensen. Ik noem het dan werknemers, omdat wij vanuit het werkperspectief kijken. En wat zijn dan de problemen die mensen tegenkomen? En ja, ook in vergelijking met Q-koorts, misschien met de zogenaamd vage klachtenachtige dingen. Wat komt er tegen?
Nou, een belangrijk aspect vind ik om te noemen is het feit dat mensen, en we zien nog ongeveer 1/4 van de mensen die zich bij ons aangemeld hebben, die komen uit die eerste fase van de COVID. En dat is in ieder geval in Nederland, en dat zal per land wat verschillen, maar in Nederland werd er toen nog niet direct getest. Waren er nog niet grootschalige testen. En als gevolg dat mensen eigenlijk wel het vermoeden hebben van COVID, langdurig klachten overhouden, maar geen positieve test kunnen overleggen. Dat zagen we uit de Q-koorts ook. Dat hebben we ook nu geleerd. Dit is een groep die echt wel extra aandacht verdient. Want vorig jaar na de zomer, 2020, toen is dat testen goed op gang gekomen. Mensen konden dus aantonen dat ze COVID hadden gehad. En een positieve test betekent dus ook eigenlijk bewijs naar je werkgever, naar je bedrijfsarts, dat je daadwerkelijk COVID hebt doorgemaakt. Maar dat geldt voor die eerste groep niet. En dat zijn mensen die echt nog wel in een ander traject komen. Die mogelijk al iets onder de leden hadden. Dat kan, hè. Maar het zijn ook mensen die bij een bedrijfsarts die zegt, ja, weet je, die klachten kunnen van de COVID komen, maar je kunt ook niet aantonen dat je het gehad hebt.
Ja.
Dus dat is wel een hele complexe groep. Andere groep zijn de mensen die in de zorg zelf ziek zijn geworden. We hebben er schrijnende voorbeelden van, echt op patiëntniveau. En ik heb je in ons voorgesprek verteld over een vrouw werkzaam in de zorg, een jonge vrouw, die in haar werk besmet is. Juist in die eerste fase waarin mensen nog onbeschermd rondliepen, waarin alles nog op gang moest komen. We leren, maar toen moest er nog geleerd worden. Die mevrouw is ziek geworden, heeft het mee naar huis genomen. Haar man is overleden ten gevolge van de COVID. Zit met 3 jonge kinderen, blijft ze achter. Een armoedeval, een echte terugval naar 70% van haar inkomen. En dat zijn echt schrijnende gevallen waarvan we denken van ja, en daar proberen we ook alle zeilen bij te zetten met advies, begeleiding, de weg zoeken in het reguliere stelsel. Want we kunnen niet meer dan dat om zulke mensen te helpen.
Ja, dat is inderdaad, we hebben het daar gisteren ook over gehad in ons gesprek over dit schrijnende voorbeeld. En ik denk ook dat, dus zeg maar, het beslaat ook eigenlijk het beslaat ook een heel breed deel van je leven. Het is, je bent, niet alleen kun je niet meer werken, maar niet alleen ben je ziek, maar je kunt ook niet meer werken. Je bent je inkomen kwijt en in dit geval zelfs je partner, je man, dus je verlies van een dierbare. Dus dat beslaat een heel breed scala. Wat zijn er, even los van deze mevrouw, maar ook even weer wat breder, wat zijn de problemen die mensen op hun werk tegenkomen bij het reïntegreren? Wat is ook het typische van deze ziekte, waardoor dat reïntegreren zo ingewikkeld is?
Ja.
Hoe gaan werkgevers ermee om? Ook een vraag die in dit verband belangrijk is.
Het zijn goede vragen. En in de eerste plaats de klachten die mensen hebben. Inmiddels zijn ze wel bekend. Maar ik noem ze toch maar, wij tekenen ze ook allemaal op. Dus we hebben een goed overzicht van wat de meest voorkomende klachten zijn. Dat zijn de brain fog, het niet goed kunnen concentreren, de vermoeidheid, de term van er zit een olifant op mijn borst met ademhalingproblemen. Dat zijn de meest gehoorde klachten. Concentratieproblemen. Wat ook erg kenmerkend is voor long covid, maar dat was het ook al bij Q-koorts, is de nawee van de infectieziekte. Dat is niet heel gelijkmatig, het komt in pieken. Ja. Dus als ik dan de vertaling naar werk ga leggen, het ene moment kan iemand best goed werken en het volgende moment is hij doodop. Dus het beeld wat een werkgever ziet, is iemand die het ene moment eigenlijk heel goed vooruit kan, het volgende moment minder goed. Dus het omgaan met die wisselingen is lastig voor werkgever, ook voor werknemer. Wat je ziet is enerzijds begrip, maar je ziet soms ook onbegrip bij werkgevers. Lang niet bij iedereen. Maar je ziet ook dat de patiënt zelf, want soms is hij of zij ook zijn ergste vijand van zichzelf, door de druk heel hoog te leggen, want ik moet toch gaan werken. We zien ook heel veel jonge, gezonde mensen, dus echt niet het prototype van een ongezond iemand. Jonge mensen die van de ene dag op de andere dag ziek zijn geworden en dan denken van, maar dit overkomt mij toch niet? Dus ook de druk zo hoog voor zichzelf opvoeren. En dat doet ook geen goed aan het herstel. Dus geef het de tijd. Integraal denk ik, juist in die eerste lijn, goede samenwerking tussen de ergotherapeut, fysiotherapeut. Dus echt die basisbehandelaars samen laten werken om samen weer te bouwen aan de conditie en het herstel.
Ja, eigenlijk ga je eigenlijk al een beetje in op mijn volgende vraag. Want dat is, wat zijn nou de meer algemene lessen die jullie uit deze ervaring trekken? Hè? Je noemt de samenwerking tussen ergotherapeut en fysiotherapeut, maar ik zou me kunnen voorstellen dat ook de samenwerking tussen de bedrijfsarts en de algemene gezondheidszorg, een onderwerp wat we gisteren ook op het programma hebben gehad, niet specifiek samenwerking tussen die twee artsen, maar occupational health and safety en public health, dat zijn twee issues. Dat zijn velden die, het lijkt wel alsof die elkaar nooit ontmoeten. En dat zou toch hier, is dat hier ook aan de orde?
We hebben pas, want wat we doen is ook aan de politiek en aan de overheid alle signalen afgeven van dit is wat wij zien rondom die patiënt. En we hebben recent ook voor de politiek een position paper hebben ontwikkeld. En een hoofdthema was samenwerken inderdaad, elkaar ontmoeten. C-supporters in het leven geroepen om vanwege alle schotten in de zorg, in al die kolommen tussen bedrijfsartsen, maar ook huisartsen, tussen de zorgverleners. De patiënt is daar niet bij gebaat. En wat wij doen is proberen heel breed ook erop af te stappen op die zorgaanbieders, ze met elkaar te verbinden om juist die samenwerking te bevorderen. En ook het niet ieder aspect apart te zien. Ik noemde net die mevrouw, maar we hebben ook nog een ander voorbeeld van een mevrouw die heeft 2 kinderen, heeft een eigen huis, die kan niet meer werken, maar die komt niet in aanmerking voor ons sociaal vangnet, want ze heeft een eigen huis. Maar haar huis verkopen kan niet, want de wachtlijst voor een huis is 10 jaar. Ja, weet je, dat zijn dan van die, dus uiteindelijk kijken we naar het ene probleem, maar het moet via de gemeente opgelost worden. Dus zo kijken we heel integraal. De schotten voorbij en de patiënt in het midden zetten.
Het is een mooi voorbeeld ook van zeg maar een organisatie die begint bij het individu. Het zijn allemaal individuele mensen die bij jullie aankloppen en jullie bieden eigenlijk individuele hulp. Maar er zijn natuurlijk, daarmee signaleer je ook al die mismatches in het systeem, zou ik maar zeggen. Hè? Of de systeemfouten. Het feit dat alles zo in silo's werkt, hè? Met schotten ertussen, et cetera. Want in hoeverre doen jullie daar iets mee? Je noemde dat position paper. Misschien kan je daar iets over zeggen wat dat nou betekent. Is dat geschreven voor het ministerie? Wat gebeurt er dan met die inzichten van jullie? Want het is natuurlijk een fantastische bron van kennis ook. 9000 mensen die zich melden bij zo'n organisatie als die van jullie. Ik denk dat menig onderzoeksinstituut er jaloers op zal zijn. Dus,
ja, dat realiseren we ons ook wel. En we willen ook zorgen dat onze data ook voor onderzoekers goed op orde zijn. Maar inderdaad, die signalen naar politiek en overheid vinden wij ook een belangrijk gegeven. Maar ook naar de zorgaanbieders. Onze mensen geven heel veel scholing. Want ook uit de Q-koortsepidemie hebben we geleerd van scholen. Zorg in het begin dat je met kennis van de ziekte mensen benadert. Want dan kunnen mensen al stappen maken. Onderzoek is ook belangrijk. We gaan uit van de trias. Dus ook bij onderzoek kijken we mee. En richting politiek en ministerie organiseren we de kennis door bijvoorbeeld in begin dit jaar, komend jaar gaan we rondetafelgesprekken met allerlei stakeholders organiseren. Om daar heel veel kennis uit op te doen van waar staan we nu, maar waar moeten we ook naartoe? Wat is er de komende jaren nodig? En dat wordt denk ik een heel mooi document wat we aan gaan bieden aan de overheid om lering te trekken en weer volgende stappen te maken. We zijn allemaal lerende organisaties en we weten het nog niet.
Ja, en dan een laatste vraag. Misschien wel een beetje een lastige. Ik denk van, oké, individuele gevallen, je leert heel veel onderzoek, praten, position paper, communicatie, heel belangrijk. Hè? Want ik denk dat zeg maar, dus mijn vraag is een beetje in hoeverre moet het systeem zelf ook veranderen of doet die communicatie zijn werk? Dat is soms heel ingewikkeld om vast te stellen. Hè? Van willen we, want het systeem verandert al als het communiceert. Hè? Dat is natuurlijk ook, wij kunnen heel verschillend omgaan met een systeem. Maar het systeem zelf moet misschien ook veranderen. En dan een vraag is ook, in hoeverre kan wetgeving daarbij helpen? Nationaal niveau, maar ook internationaal of Europees niveau. En ik denk bijvoorbeeld aan erkenning van COVID-19 als een beroepsziekte. Ik noem maar even een dwarsstraat. Ik bedoel, want je noemde in het begin dat die mensen, ik geloof dat het 1/4 is van jullie bestand, die niet gediagnosticeerd is. En de rest is dan wel gediagnosticeerd. Helpt dat nog, zeg maar het feit dat het erkend wordt als ziekte? Nou, dit zijn een heleboel vragen in één. En
ik snap hem.
Dus je wilt antwoorden, ja.
Ik zal hem proberen compact te beantwoorden. Kijk, wij veranderen natuurlijk als C-sport het systeem niet. Maar ik hoop wel, en dat is natuurlijk onze drive ook wel, dat we vanuit waar die patiënt tegenaan loopt, dat we wel stukjes van het systeem of bewustwordingen kunnen bewerkstelligen om het systeem stukjes te veranderen of, wat jij zegt, de communicatie te verbeteren. Tegelijkertijd zeggen we altijd, we gaan niet op de stoel van wie dan ook zitten. Dus ook niet op de stoel van de politiek. We proberen heel onafhankelijk te adresseren, te signaleren. Maar het is de politiek die uiteindelijk de keuzes moet maken. En zo ook met het feit of dat je van de long-covid een chronische ziekte moet maken. Beroepsziekte vind ik nog moeilijker. Dat is aan de politiek. Ik denk dat je dat nou eigenlijk op persoonlijke titel, dat we dat gewoon nog niet kunnen zeggen. We weten het nog niet. En dat is wat we wel moeten doen. We moeten leren, zien wat er gebeurt, goed optekenen. Meten is weten, dus vandaar ons bestand ook proberen goed op orde te houden. om wel gaandeweg te begrijpen van en hoe is het verloop van die ziekte. Zoals we dat ook geleerd hebben van de Q-koorts, kunnen we dat ook leren van de COVID. Maar nu weten we het nog niet.
Ja, blijven leren en blijven volgen. En ik weet dat jullie heel interessante cijfers hebben, ook uitgesplitst naar seksen en bevolkingsgroep en ik weet niet wat allemaal. Dus dus behalve dat het heel goed werk is wat jullie doen, is het ook een bron van kennis. Het is, Annemiek, het is 11:55. Ja. Dat klinkt heel serieus. Ja. Maar ik wil je hartelijk bedanken voor dit gesprek. Ik vind het zelf altijd, mij boeit het altijd het meest om te spreken over de mensen om wie het gaat. En ik denk dat jullie werk zit ook, is in direct contact met die mensen. Dus in die zin niet alleen heel nuttig, maar voor mij ook, dat interesseert me eigenlijk het meest in dit leven. Dus hartelijk dank, ook voor het feit dat je zo last minute hebt willen instappen. Enorm gewaardeerd. Dank je wel.
Graag gedaan en ik wil mensen uitnodigen om op onze website te kijken www.c_support.nu en er is ook een Engelse variant voor verdere toelichting, dus dat helpt.
Hele goede aanvulling. Ja, dankjewel.
Okay. Ja, jullie ook bedankt.
Ja.
Dag.
Paula. Yeah.
Thank you, Marian, and thank you very much, Annemieke de Groot, for telling us about the situation of people who are suffering from the long COVID and also the remarkable work that the organization C-Support is undertaking in the Netherlands. Now you can read more about this topic and the organization in the ETUI publication called the HESAMAG. And I would now actually like to take a few moments to discuss this specific publication from the ETUI. I hope you can see my screen and it's full. Okay, very good. So as many of you know, for us at the Unit 3 at the ETUI, it's fundamentally important to connect our research, our analysis, and all the work that we are doing with the real lived experience of the workers. So to really work for and work with the trade unions. And we search for the opportunities to learn from people and to hear what is actually happening on the shop floor level at the workplaces. And we feel very grateful to have the strong connection to a variety of workers and trade unions. Now, HESAMAG, the ETUI Health and Safety magazine, is one of our publications that really embodies the connection to workplaces. And today we have available for you the new edition, the number 24 of HESAMAG, which focuses on workplaces in the pandemic. Now, in the chat box of this meeting, you can find the web link to the publication, and you can also register on our website to receive a free hard copy of this magazine and the forthcoming issues. Now, in this issue number 24, our main aim has been to illustrate and document the impact of COVID-19 on workers and the experience of the pandemic as an occupational health and safety issue around Europe. And this edition brings you stories and it describes experiences that address many of the topics we have discussed during this conference, so yesterday and today. Now, yesterday we, for example, heard about the contested evident connection between public health and occupational safety and health. And in the HESAMAG, you will find reflections on this issue. We also had a panel yesterday dedicated to psychosocial risks at work. And in the HESAMAG, we do have an article that is further unpacking the idea or the expectation that a teleworker needs to be resilient and flexible and how it is very, very important to approach this kind of narrative with a critical view and from the perspective of psychosocial risks. Now, you also heard this morning about the real ordeals of workers in education, food production, and transport sectors during the pandemic. And the HESAMAC 24 will provide you more insights from diverse work contexts, such as refuse collectors in Paris, the funeral sector in Romania, and the National Theatre in Croatia. So this is just a taster of what HESAMAC 24 has to offer and how it really parallels with the teams that we are working on as a researchers at the ETUI. But that's all from me now, and I'd like to pass the floor back to Marianne for the closing remarks and reflections of what we've heard over the 2 days. So over to you, Marianne.
Thank you, Paula. And thank you for presenting HESAMAC. It's one of our prides, I may say. By the way, I didn't hear you mention it, but it's possible to it's free for to have you can register for the magazine for free. So that is I think a link was presented already in the chat, so you're welcome. Yeah, so now the challenge for me to wrap up and to conclude, and I have been thinking, how shall I do that? I have made several outlines of my conclusions, but I decided to start with one main, big, obvious conclusion, and go around that one. I think that well, the topic is lessons learned from the pandemic. For OSH, lessons learned for OSH from the pandemic. My main conclusion of those 2 days and also of the years that lay behind us is that the pandemic has worked as some kind of magnifying mirror on OSH issues that have been there forever. But now, with the pandemic, all of a sudden, these issues come into broad daylight. They come into the attention of broader society. It's not just OSH specialists, OSH technicians, OSH experts that deal with these issues in their ivory tower, unseen from the rest of the public. No, the pandemic, and it sounds as if the pandemic is a fantastic chance for OSH. It actually is. But of course, this comes with the sadness about the pandemic. We'd rather not have had this chance. But it is there, it's an opportunity. It has been mentioned by several of the speakers, I think. Magnifying mirror, it shows issues that have been there forever. What about the meat processing workers? They have been working in miserable circumstances, living conditions that are horrible, making long days, having accidents all the time. They have been in dire straits for ages. All of a sudden, with the infection of those workers, with an outbreak within a factory, this was hot news. It was front page news for a couple of days in a row. Why? Because it's not only those workers being affected, but the whole broader public. All of a sudden, this has become the problem of those meat workers have become a risk for the broader public, and that that we can be cynical about it. Oh, well, now that it has become a broader problem, all of a sudden we care. Yes, that's what we do. I mean, it's so. The same with hospital workers that fall ill. All of a sudden we care because hospitals need to function for all of us. Education, we just had the panel before us also telling us about the situation in the education sector. How many parents haven't children in the first place, but also their parents haven't suffered about the situation in education. It's something that you know. So this has become a broader problem. If educational workers fall ill, or if they have to telework for that matter, it becomes a problem for the children. They experience really psychological problems. Their parents have care responsibility. So that is the main conclusion. It has worked as a magnifying mirror, and thereby created an opportunity, because with visibility, we have an opportunity to do something. And in that respect, we then also see the connection that ORS has with other areas. The broader labor law issues, for example. If workers don't have the basic rights, it was just mentioned in the panel before as well, the basic rights, for example, on sick pay, sick leave pay, then they just cannot stop working. They will continue working and they will infect others, or they get in real trouble. So the connection with broader labor law issues is there. Working conditions, employment conditions. Is your contract a fixed one, or is it a long-term one? Is it there forever? Are you safe to take your sick leave and to recover? Those kind of things. So the connection to broader labor law and also to other fields of society. And there we come, of course, to the public health issue, the first issue of this conference. So there is an opportunity to bring ORS further. But how? How to do that? And that is a complex issue. I think one element that we can build on is the fact that we, as ORS experts, and I don't know if in the audience all of you are ORS experts, but I think I gather it's many of you. One of the elements that we can build on is that we have the know-how, we have the knowledge. This was also mentioned. It was really, really clear in the first panel, I think. There we spoke about the connection between ORS and public health, ORS being a very strong determinant of public health, of the quality of public health, of the quality of the health of the public, let's say. And there it became clear that if we want to do something about better ORS, the knowledge of ORS people needs to be taken on board. Peter Noon clearly stated that in the beginning of the pandemic in Ireland, their ORS knowledge was sidelined. It was not taken on board. And thereby, they missed a lot of opportunities to diminish the contamination in, for example, the healthcare sector. Chris de Meester, he mentioned the fact that, how did he say it? There are principles in public health, but we, at shop floor level, in the companies, in the sectors, we take measures, we make it concrete. That's also a matter of knowledge. So I think that's an important basis. We have the know-how. That is also, for example, what we saw in the second panel. The second panel was about psychosocial risks in telework. And here also, knowledge is an important basis. And we have the knowledge, but it's important to spread it. In this panel about psychosocial risks in telework, we spoke about the conceptualization of the problem of psychosocial risk, meaning what do we mean with psychosocial risks? What are the causes? What are the risk factors? What are the consequences? How does it work? So that is what I mean by conceptualization, and it is something that we are working on. We also saw that the pandemic has brought new elements into this conceptualization of the problem. For example, what if telework becomes massive? If all of us telework, what if we work telework 5 days a week? That's something else than the 1 or 2 days that we were allowed to beforehand, if we were allowed to have them beforehand. Telework, voluntary or mandatory, there's a big difference about that. So all those elements that came up with the pandemic can be taken on board in this conceptualization. And another element is, of course, and that also came really to the forefront during this pandemic, the strong gender aspects that telework has brought us during the pandemic. It has positive sides, but it also has a difficult side to work from home. It can foster the work-life balance, but it can also complicate the work-life balance, and it can complicate the execution of your job. So gender elements taking on board, that's about conceptualization, taking all elements on board. And then finally, really important, what can we do about it in the sense of regulation? And and there again, we see that knowledge is key here. Because at European level, until now, there is no psychosocial risks directive, which is really strange because it's one of the main risks that we face nowadays. And let's stop calling it new and emerging. It's already there for decades. And still it's being treated as something exotic, something vague, something that cannot be regulated. Well, knowledge shows, if we gather information, then it shows it can be regulated. We are now at ETUI, Otse Valiello, who spoke yesterday, she's conducting a mapping of European member states' regulation on the issue. And there it shows that that the issue can be regulated. And we are going to connect the conceptualization of the issue that will be carried out, by the way, by Paula Franklin in the coming year. We are going to connect that conceptualization with the legislation. The legislation, of course, has to be fit for purpose. There is a problem, we can legislate it. And we do have examples of member states that do regulate in a very adequate way. They do tackle the problem as we have or are in the process of conceptualizing it. So that's really interesting. Knowledge, we have the know-how, but how to use it. There is an opportunity how to use it. The third panel was, I have listened to it with really, really great pleasure. I think the information that was brought by the discussants was really on topic, and it showed the problems in the different sectors, also possible solutions, and it also showed similarities between the different sectors. It was also something that the speakers that I spoke to in the break, they also said, yeah, basically it's similar problems, but it all has a different expression in different sectors. And we also saw that solutions need to be targeted. It need to be tailor-made. They are not the same in the one sector than they are in the other sector. This depends, of course, on the kind of work, but also on the social partner relations. So it's about enhancing communication. So negotiation. So consultation of workers, collective bargaining is really important, but sometimes it's also needed to seek the confrontation, as the panelist of the public transport sector clearly told us. He has, I think, 3 or 4 times stipulated we need to go to court because it seems that the employer has not learned from what is going on. In other sectors, we heard solutions. There is this magnifying mirror, and then finally we have spoken about the shop floor level, and this is as Paula also mentioned, it is in the genes, in the DNA of our research unit on health and safety here at ETUI. I often put it as a motto: everything we do here should be for the benefit of the workers at shop floor level. Well, now I know that this is really, really difficult, to comply with, let's say, to fulfill, because we are at European level. But I think OSH management, OSH regulation is a building. It has many building blocks, and it has many levels of action, and all those levels need to do the thing that they need to do. And then at European level, that is in many ways, it's about regulation. I spoke already about the Psychosocial Risk Directive that is needed, but also the directive that my colleague Tony Musu spoke about in the panel 3, the Biological Agents Directive. It's also an OSH directive, and it has not taken on board the issue of a pandemic situation. And and there again, it's really clear that we have the knowledge. It's because Tony has made a fantastic analysis on how to improve this directive. It's doable, it's simple, it's useful, it's targeted, it's there. So now it comes down to communicating these solutions. Communication is key, and and there I am at the beginning of my opening words. Communication is key, not only for us as human beings, but also to reach the target, to really be able to grasp this opportunity that the pandemic has given us. There is a spotlight on OSH. OSH is really, really hot at the moment. And the only way to deal with that is to base us on our proper knowledge and go out there anywhere where you are to spread the message. So with those words, I would like to close and hand over to you, Paula, again. Thank you very much for your attention. I want to thank all of you. Let me not forget to thank you as participants being with us. Really, I'm really thankful. I want to thank all of the speakers. I think we had a high level of contributions from all of you. I have been listening with the red ears, as we say. And last but not least, I want to thank Paula and Paula Franklin, and also behind the scenes, Aafje de Hooge and Dominique Swan, who do the logistics of this conference, always with great care, and of course, the interpreters. Paula, you might repeat the thanking words, but I couldn't leave it out. So thank all of you, and back to you, Paula. Thank you.
Thank you, Marianne, for bringing together the key points and messages from the past 2 days. I really don't have anything to add except to thank you for the audience for joining us and actively participating with your questions. The PowerPoints are now available on the ETUI website, and the recording will also be available on the same websites very soon. And with this, I wish you a very good end of the year, and please do keep in touch with us. Thank you very much for everyone. Bye.